Mark, you've been watching TV all day. What are you doing?
I'm watching my favorite superhero, Mama.
What happened? Are you okay? Did you swallow a coin?
Mama, coin.
We'll go to the emergency room right now. Let's go. Nurse, help me. My child, he's choking.
Okay,
He swallowed a coin.
Okay, let's get him up over here, okay?
Is he gonna be okay?
He's gonna be just fine, okay? Can you give me your child's name?
His name is Mark.
Hi, Mark. My name is Jose. I'm super nurse, okay? Can you give me one of your fingers? Put it out like this.
This one?
Yes, that one. I'm gonna put this pulse ox on you. It's gonna check your oxygen levels, okay? So don't panic. Can you point out to me which one you feel like you are right now?
This one.
The 6, okay. How long ago did he swallow the coin?
About 10 to 15 minutes ago.
Okay. Are you able to breathe okay? Okay. Your pulse is at 106, but your oxygen's just fine, okay? Hello, good morning, Doc. I have a patient here named Marky Alvarado, 5 years old. I was able to take the vital signs earlier. They had a little choking incident. Looks like the child was swallowing a coin. I took the vital signs, like I said. We have a 95 beats per minute on the heart rate, 40 breaths per minute, just slightly elevated on the respiratory rate there. Temperature is setting just fine, 99.2, and blood pressure is at 110/52. The patient also described that the pain on the FACES pain scale, it was a 6 out of 10. But it looks like they're breathing a little all right. The oxygen levels said that it was at 95%. It looks like maybe some just irritation, some slight pain.
Okay, get the x-ray and I'll be on my way. Bye.
Hello.
Hello, nurse.
Hi, Marky. It's Super Nurse again. I've got your results for you here, okay? Are you still having a difficulty breathing a little bit? No? Okay. Well, his, respiratory rates are a little elevated, but we found out why. This is his x-ray right here. So the coin did get stuck a little bit, but luckily it's not blocking his airways all throughout. So we're going to have a specialist remove that, okay?
So what's gonna be the procedure? Are they gonna put him to sleep?
They will. We'll have a specialist put him to sleep, and then they're going to remove the coin, okay?
Is it gonna be painful for my child?
No, it's not going to be painful at all. He won't even feel it, and by the time he wakes up, he'll be noticing that he's just perfectly fine.
Okay, thank you. Please take care of my child.
Of course.
Thank you. Hi, nurse. How is it?
Your child's just fine. The procedure went well.
That's good.
We were able to remove the coin, and his respirations have also stabilized.
Is there any problems?
No, there are no current problems, but since now that the procedure is done, all chief to be able to check for the next few days for any signs of discomfort, difficulty in swallowing or breathing. If he still has those signs, he can go ahead and bring them back here. We'll take care of it. We'll check him again. And now that the procedure is done, I want to be able to go through a few of the safety procedures that we have and safety precautions that we have for at home, okay? And I'm going to give you some knowledge on that.
All right, thank you so much.
Of course.
How are you feeling?
What happened?
You're all okay now. I'll make sure that won't happen ever again, okay?
When setting up your baby's crib, always make sure it meets safety standards, with slats no wider than 2.25 inches. The mattress should be firm and keep the crib bare. No pillows, blankets, or bumper pads. Always place your baby on your back to sleep, and check the crib regularly to ensure it is in a good condition. As your baby grows and becomes more mobile, be ready to transition to a toddler bed. crib safety is essential for creating a safe, peaceful sleep environment for your little one. Other than crib safety, you also want to make sure your child is eating safely. During the first year, food safety is critical to your baby's health. Start with exclusive breastfeeding or formula feeding and properly store milk or formula. When introducing solids at 6 months, offer a single ingredient purees and avoid honey and unpasteurized food. Cut foods into small, soft pieces to avoid choking, and always refrigerate leftovers immediately. Be aware of high-risk foods like whole nuts, raw meat, and unpasteurized products. Foods such as grapes, apples, nuts, hot dogs, and small foods are potential choking hazards. Following these safety guidelines will ensure your baby gets the best start on their feeding journey. Another safety that we need to ensure is car seat safety. Car seat safety is vital for a child's protection while traveling. For newborns and infants, always use a rear-facing car seat until at least 2 years old. Afterward, transition to a forward-facing car seat with a 5-point harness until your child outgrows it. Then, switch to a booster seat until the vehicle seat belt fits properly, usually around age 5 or 6. Always ensure the car seat is installed correctly and never use expired or recalled seats. Following these stages ensures your child's safety on every journey. It is also important to keep children away from the outlets around the house.
It is also important to keep children away from the outlets around the house. Electrical safety is a critical aspect of creating a safe environment for your newborn. Always use outlet covers or considering temporary seated outlets to prevent access. Keep cords out of reach and avoid using extension cords, which can be easily pulled or tripped over. Regularly check for any damage to electrical components, and as your baby grows, teach them about the danger of electrical outlets. This simple precaution can protect your child from potential electrical hazard. Safety. Safety is the most important thing to consider when caring for your newborn. Ensure they sleep safely on their back in a bare crib with a firm mattress. When in the car, always use a rear-facing seat and make sure it's properly installed. Baby-proof your home by covering electrical outlets, securing furniture, and keeping harmful objects out of reach and out of sight of your baby. Pay attention to hygiene and always be proactive in making your environment as safe as possible. These simple steps will easily keep your newborn protected and secure.